Cranial nerves in dogs and cats. So for an overview, there are 12 cranial nerves with sensory, motor, and parasympathetic functions. Cranial nerve 1 is the olfactory nerve, cranial nerve 2 is the optic nerve, cranial nerve 3 is the oculomotor nerve, cranial nerve 4 is the trochlear nerve, cranial nerve 5 is the trigeminal nerve, and cranial nerve 6 is the abducent nerve, and cranial nerve 7 is the facial nerve. Cranial nerve 8 is the vestibulocochlear nerve, and cranial nerve 9 is the glossopharyngeal nerve, and cranial nerve 12 is the hypoglottis nerve. The olfactory nerve is not routinely tested due to bilateral smell integration. For the optic nerve, we can do the Menis response or the pupillary light reflex test or the falling cotton test. The optic nerve is responsible for vision transmission. For the oculomotor nerve, this controls eye movement and constriction of the eye. So the signs are ventrolateral strabismus and pupillary dilation. So for the tests, we do the pupillary light reflex test and the Menis response test. For the trochlear nerve, it controls the downward rotation of the eye. So the signs are dorsolateral strabismus. So basically we see a dorsal oblique muscle dysfunction. And for the test, it's the Menis reflex test. For the trigeminal nerve, the branches are the ophthalmic nerve, the maxillary nerve, and the mandibular nerve. The trigeminal nerve is responsible for facial sensation and chewing. For the motor test, we assess the masseter muscles, the symmetry, and the jaw resistance. The adducent nerve controls the lateral eye movement. So the signs of this is medial strabismus. So the lateral rectus muscle of the eye has dysfunction. The facial nerve, the functions are facial expression, taste, lacrimation, and salivation. And the vestibulocochlear nerve, the functions are hearing and balance. And the signs are nystagmus, head tilt, and ataxia. The glossopharyngeal nerve controls taste and swallowing. It has the gag reflex as well. And the signs of dysfunction are dysphagia and coughing after drinking. And the hypoglossal nerve controls tongue movement. The tests are the tongue movement test and see if there's any atrophy or if they're able to retract the tongue. Horner syndrome is a sympathetic denervation of the orbit. The signs are a myotic pupil, ptosis, enophthalmos, and a prolapsed third eyelid. And for vestibular disease, it can be peripheral or central. If it's peripheral, it'll have inner ear involvement and no brainstem signs. If it is central, we'll see cerebellum involvement, and it may include brainstem signs, such as altered consciousness and paresis.